Hello students, so we are back in live again. Good evening. uh, so आज हम emerge batch का जो chapter continue कर रहे हैं, which is going to be the reproductive health, and today we are going to discuss its second part, जिसमें हम इस chapter को complete करेंगे आज. All right. So till your first part we have already done and dealt with some of the basic concepts of reproductive health, and along with that we have also dealt with the some of the contraceptive methods. So we will continue with the same aspect. उसी aspects के साथ हम आज continue करेंगे related with some of the important topics and regarding the MTP, STDs and ARTs. उसके बारे में deal करेंगे, and then we will also be discussing about the some of the important things that are being found in there. All right. So let us quickly start with the topics now. So previous lecture में we had done till the part of IUDs. IUDs तक का हमारा पूरा पार्ट हो चुका था. All right. Now the part that we have to start today are the pills part. All right. So here. So we are going to start today the pills. Now pills also is one of the methods, or you can say one of the oral contraceptive method you can consider as pills. So these are oral contraceptive methods. Clear? So these are actually the oral contraceptive methods which are widely used in case of our country, and this can be a combination of hormones. ये hormones का ही combination होता है जो हमारे body में produce होते हैं, but ये pills के form में available होते हैं. All right. So they are small doses of either progestogens or progestogen estrogen का combination. That is another contraceptive method which is used by females. So again, pills are only and only used by females only. So this is for females only, which is primarily being utilized or used, you can say. And these pills, they are actually available in the form of tablets, and hence they are popularly called as pills. So since these are available in the form of small doses and tablet, so that's why they are called as pills. Now these pills, they have to be taken daily. Now if you consider its dosage, all right, so it is to be taken daily. All right. And apart from that, taken daily, and that too for a period of 21 days. Except you can say the days of the menstrual cycle. जो menstrual cycle का day होता है, menstrual flow का जो day होता है, phase होता है, सिर्फ उसको छोड़ करके ultimately ये 21 days इनको पूरा लिया जाता है. So except the 7 days of menstrual flow, you can say. So this is the case. So here it has been written that pills have to be taken daily for a period of 21 days, starting preferably within the first 5 days of the menstrual cycle, and after a gap of 7 days during which the menstruation actually occurs, it has to be repeated in the same pattern. So pattern जो होगा वो वही रहता है. So pattern is actually, it remains the same till the females desires to prevent the conception, till the female actually desires to prevent the conception method. ठीक है. तो pills जो होते हैं ना, pills का जो main target होता है, इतना ये मैं आपको बता दूं, that main target is actually that they inhibit, just a moment. So their main target is that they basically inhibit ovulation, and apart from that they also inhibit the process of implantation as well. So ये inhibit करते हैं ovulation and implantation. So they inhibit ovulation and implantation, as well as alter the quality of the cervical mucus to prevent or retard the entry of sperms. ये आपको ध्यान में रखना है, ठीक है? Now pills, they are very effective with lesser side effects and are well accepted by females. And इसका best example मैंने आपको already पिछले lecture में बताया हुआ था, that Saheli, which is the new oral contraceptive for females, contains a non-steroidal preparation, once a week pill with a very few side effects and high contraceptive value, which was developed by CDRI, that is Central Drug Research Institute के through जो ये develop हुआ है. So one of the best examples you can say of pills are Saheli pills. Saheli. So that is the case. तो ये मैं इसके बारे में मैंने आपको already बताया हुआ था. Clear? तो ये part हो जाएगा. Now apart from that, progestogens ये तो pills के बारे में हो गया. Now let us take a look into the next important factor, that means the next important method through which the contraceptive method through which the chances of pregnancy can be prevented, and that is considered to be as basically your injectables or implants. So this is basically called injectables. Just a moment. Injectables or implants. तो ये होता है, ठीक है? इंजेक्टेबल्स और इम्प्लांट्स जो होते हैं, these are basically, ये भी फीमेल्स के लिए ही यूज होगा, and that too, as the word is suggesting, that this injectables or implants, they are used under the skin of the female. So this is actually applied under the skin of female. So इनका जो सीन होता है, इनका जो मोड ऑफ एक्शन अगर मैं आपको बताऊं, तो इनका मोड ऑफ एक्शन इज सिमिलर टू दैट ऑफ द पिल्स दैट इट इज बीइंग यूज्ड. कॉन्ट्रासेप्टिव पिल के तरह मोड ऑफ एक्शन होगा. ये भी ओव्यूलेशन एंड इम्प्लांटेशन को प्रिवेंट करेंगे. जैसे अगर आप यहाँ पे देखेंगे, सो इनका जो प्रेपरेशन होता है वो प्रोजेस्टोजेंस का ही होता है, या तो प्रोजेस्टोजेन या तो एस्ट्रोजन के कॉम्बिनेशन के साथ इनको बनाया जाता है, एंड इंजेक्शंस या इम्प्लांट्स के फॉर्म में अंडर द स्किन दे आर बीइंग applied of the females. Now their mode of action is similar to that of the pills, and their effective period are much longer. However, देखो pills का कैसा था कि pills have to be taken daily, orally उसको लेना है, and that too daily लेना होता है. लेकिन implants के साथ ऐसा होता है कि इनका effectiveness ज़्यादा है होता है pill से, but this is something which is already implanted under your skin, so you need not to have any kind of pills or something or any kind of treatment regarding that. वो सारी चीजें नहीं होती हैं इसमें. So administration of progestogens or progestogen estrogen combination or IUDs, they within the 72 hours of coitus have been found to be very effective. Now इसमें जो एक चीज ध्यान देने वाली बात है वो ये हो जाएगा कि IUDs होते हैं, चाहे वो इंजेक्टेबल्स या इम्प्लांट्स होते हैं, so 72 hours of coitus के within में ही, that means 72 hours of having the sexual intercourse के within में ही ये effective होंगे. They are effective only and only when they are used within 72 hours of coitus. And within 72 hours of coitus में कौन सा effective हो जाएगा? Either IUDs or you can say the pills. These are effective only within 72 hours of coitus, as they could avoid the possible pregnancy due to rape or casual unprotected intercourse. ठीक है, तो ये हो जाएगा. So this is the next method, which is injectables or implants, and the last method, contraceptive method here, is considered to be as the sterilization method, and that is called as the surgical method. तो जो next method हमारा होता है वो हो जाएगा surgical methods, or you can actually consider it to be as the sterilization method. Just a moment. Yeah. So नेक्स्ट जो मेथड हो जाएगा वो हो जाएगा स्टेरिलाइजेशन का मेथड. एक मिनट, आई गेस देयर इज अ लिटिल प्रॉब्लम. Just give me a moment. All right. So sorry for the little inconvenience. I guess there was some problem in the website for that reason only. For inconvenience. So we were at this point of the sterilization. तो basically हम sterilization की बात कर रहे थे. You can see over here. तो sterilization में basically surgical method होता है which is called as the sterilization. So we were dealing with sterilization. So sterilization we all know is basic. Sterilization is something which is performed in case of both males and females. So this can either be in males also and this can either be in females also. So males and females ये दोनों में हो सकता है. And it is either in the form of tubectomy or it can either be in the form of tubectomy or either it can be in the form of vasectomy. Vasectomy. All right. So just a moment. We will be back again in 1 minute. Just give us 1 minute and we will be rejoining again.
METAcademy joined.
Okay. So basically we were discussing about the vasectomy part. तो ट्यूबेक्टोमी मेथड होता है और देन वैसेक्टोमी का मेथड होता है, ठीक है, स्टेरिलाइजेशन मेथड में. So this tubectomy is actually performed in case of ये females में होगा. So this is in case of females actually. And this vasectomy is usually performed in case of males. ये हो जाएगा, ठीक है. So this is actually a kind of a terminal method. मतलब आप समझ लीजिए कि एक फाइनल मेथड होता है जिसकी रिवर्सिबिलिटी नहीं होती है. All right. And then there is no reversibility and then there is in fact no chances of getting the mother or the female getting pregnant. तो इसमें वो भी chances नहीं होता है that the female can get pregnant also once again in the lifetime. So that's why it is also considered to be as a terminal method to prevent any more pregnancies. So you can see over here vasectomy में आप देख सकते हैं कि इसमें vas deferens को tie करके कट करके tie किया जाता है. All right. And tubectomy के केस में क्या करते हैं कि fallopian tubes जो होते हैं उनको कट करके tie किया जाता है. So that is the difference which is being done. तो ये चीज होती है. अब इसमें जो मेन चीज ध्यान देने वाली बात है वो ये हो जाएगा कि इस दोनों प्रोसेस में गैमेट्स का तो फॉर्मेशन होगा लेकिन गैमेट्स ट्रांसफर नहीं हो पाएंगे. ये चीज आपको ध्यान में रखना है. गैमेट्स जैसे नेचुरली बनते हैं वो नेचुरली बनेंगे बट देयर विल बी नो ट्रांसफरेंस. ट्रांसफरेंस का जो प्रोसेस होता है ना वो अल्टीमेटली ब्लॉक हो जाएगा. सो दैट इज द केस. ये चीज हो जाएगी. क्लियर ना. So surgical intervention blocks the gamete transport and thereby preventing the conception method. Sterilization procedure in the males is called vasectomy and that in female is called tubectomy. Vasectomy में small part of the vas deferens is removed or tied up through a small incision on the scrotum जो मैंने अभी आपको फिगर में दिखाया. Whereas in tubectomy if you're going to see a small part of the fallopian tube is removed or tied up through a small incision in the abdomen or through the vagina. तो ये चीज हो जाएगा. Now ये जो टेक्निक्स होते हैं ये हाईली इफेक्टिव होते हैं लेकिन इनकी रिवर्सिबिलिटी जो होती है वो बहुत ही पुअर होती है. ये आपको ध्यान में रखना। All right. Now, so these were all the contraceptive methods that we have dealt today. All right. Now, the next method to start and talk about is basically the medical termination of pregnancy, which you can see over here. So, इसमें दिया भी हुआ है that it needs to be emphasized that the selection of a suitable contraceptive method and its use should always be undertaken in consultation of a qualified medical professionals. मतलब आप समझिए कि कोई भी मेथड अगर हम प्रैक्टिस करते हैं या कॉन्ट्रासेप्टिव मेथड अगर हम फॉलो कर रहे हैं तो डेफिनेटली बिना किसी मेडिकल प्रैक्टिशनर के या मेडिकल एक्सपर्ट डॉक्टर्स या नर्सेस के कंसल्टेशन के हमें नहीं करना चाहिए. एंड वन मस्ट आल्सो रिमेंबर दैट कॉन्ट्रासेप्टिव्स आर नॉट रेगुलर रिक्वायरमेंट्स फॉर द मेंटेनेंस ऑफ रिप्रोडक्टिव हेल्थ. रिप्रोडक्टिव हेल्थ को मेंटेन करने के लिए वो एक रिक्वायरमेंट नहीं माना जाता या नॉट ओनली द सोल रिक्वायरमेंट दे आर कंसिडर्ड. In fact, they are practiced against the natural reproductive event, which is conception or pregnancy. Definitely, ये एक natural जो process होता है female के body में, उसके against करने वाला ये process है. So this you need to know it. All right. तो जिसके ill effects भी हो सकते हैं, side effects भी हो सकता है, बहुत सारी चीजें हो सकती हैं. All right. So one is forced to use these methods either to prevent pregnancy or to delay or space children or pregnancy due to personal reasons. No doubt that the widespread use of these methods have a significant role in checking the uncontrolled growth of the population. However, their possible ill effects like nausea, abdominal pain, breakthrough bleeding, irregular menstrual bleeding, or even the breast cancer, though not very significant, should not be totally ignored. इनके side effects भी हो सकते हैं. तो इन सारी चीजों को सामने रखते हुए, कॉन्ट्रासेप्टिव मेथड्स को यूज करना चाहिए, या इन केस अगर कॉन्ट्रासेप्टिव मेथड अगर कोई फीमेल या लेडी प्रेफर कर रही है तो इन सब को पॉइंट ऑफ व्यू में रख के वो चीजें प्रैक्टिस करनी चाहिए. ऐसा नहीं होना चाहिए कि इट शुड बी अ काइंड ऑफ अ रेगुलर प्रोसेस ऑफ स्पेसिंग बिटवीन द चिल्ड्रन और रेगुलर प्रोसेस ऑफ नॉट कंसीविंग एनी बेबी. ठीक है, तो दिस इज द केस. सो दिस इज ऑल अबाउट द डिफरेंट मेथड्स, कॉन्ट्रासेप्टिव मेथड्स. Now let us take a look into the MTP part, which is medical termination of pregnancy. MTP. So this MTP basically stands for medical termination of pregnancy. Medical termination of pregnancy. Now, this medical termination of pregnancy, which is also considered to be as induced abortion. Induced abortion means that if a couple doesn't want to have a child, all right, or if a child or the baby is having some genetical problems, so the doctors will recommend it to go for the abortion purpose. तो उसको हम induced abortion भी बोलते हैं. ठीक है. So intentional or voluntary termination of pregnancy before full term, that is called MTP, जिसको हम induced abortion भी बोलेंगे. Now, nearly 45 to 50 million MTPs they are performed in a year. All right, all over the world, in fact, which accounts for around 1/5 of the total number of conceived pregnancies in a year. मतलब एक statistics दिया हुआ है कि 40 to 50 million MTPs जो होते हैं वो perform किए जाते हैं. Now, whether to accept or legalize MTP or not being debated upon in many countries due to emotional, ethical, religious and social issues involved in it. Now, कई countries ऐसे हैं जिसमें MTP को legalize कर दिया गया है. All right, why? In relation with some of the social, you can say social sentiments को लेते हुए या political sentiments को लेते हुए या emotional attachments को लेते हुए, बहुत reasons. Now, government in India में, MTP को basically India में legalize किया गया था in the year 1971. Remember this क्योंकि ये पूछता भी है. तो India में this MTP has been legalized in the year 1971. All right, and with some strict conditions in order to avoid its misuse. Misuse कहने का मतलब क्या misuse हो सकता है? Female feticide को kill कर, female feticide के लिए basically इसको misuse किया जा सकता है. Now, such restrictions are with all the important to check the indiscriminate and illegal female feticide, which are reported to very high in India. Now the question arises that why MTP? वो MTP जब इतना ही है तो क्यों इसको बहुत ज़्यादा popularize किया है या बहुत ज़्यादा इसको legalize कर दिया है इंडिया में? So the reason for this is that obviously the answer is to get rid of the unwanted pregnancy, either due to casual unprotected intercourse or the failure of the contraceptive used during coitus or rapes. Now, MTPs are also essential in certain cases where continuation of pregnancy could be harmful or even fatal either to the mother or to fetus or to both. मतलब एक ऐसा कंडीशन जिसमें या तो वो प्रेगनेंसी मदर के हेल्थ के लिए बहुत हार्मफुल हो सकता है या बेबी के हेल्थ के लिए बहुत हार्मफुल हो सकता है या दोनों के हेल्थ के लिए बहुत हार्मफुल हो सकता है. So in that case, this MTP has been legalized from the government. Now, this MTP is relatively considered to be safer during the first trimester. Now, this thing you need to know about it. ये first trimester में काफी safe होता है, that is up to 12 weeks of pregnancy. While in the second weeks, it is very, very riskier. बहुत risky हो जाता है क्योंकि उस time पे baby almost develop हो जाता है. That is the reason. Now, one disturbing trend observed in the majority of the MTPs are performed illegally by unqualified quacks, which are not only unsafe but could be fatal too. तो कुछ unqualified doctors भी MTP को perform कर देते हैं, nurses perform कर देते हैं, and that can be riskier for the baby also and for the mother also. Another dangerous trend is the misuse of the amniocentesis to determine the sex of the unborn child, and frequently if the fetus is found to be female, it is followed by MTP. ठीक है, तो सीधी सी बात है कि अगर amniocentesis कोई एक ऐसी जगह है या कोई एक ऐसा लोकेशन है जहाँ पे amniocentesis हो रहा है, तो amniocentesis कराने से sex of the child determine हो गया, and if it is a baby girl, then they will go for the female feticide by the process of MTP. तो MTP के through female feticide को कर देते हैं. So this is the two dangerous trends that have been followed, with this MTP. This is totally against what is legal. तो ये legal तो नहीं है, लेकिन ये illegal side को indicate करता है. तो ये MTP के बारे में. So unwanted pregnancy को prevent करने के लिए या to get rid of it. ठीक है. Now, अब इसमें जो ये practices है, all right, these such practices they should be avoided because of the because these are dangerous to both the mother and the young fetus. ये मैंने आपको already बताया कि अगर कोई ऐसा condition आ जाता है जिसमें कि ये condition dangerous दोनों के लिए हो जाएगा, तो ये MTP को legalize कर दिया है. Effective counseling on the need to avoid unprotected coitus and the risk factors involved in illegal abortion, as well as providing more health facilities to reverse the mentioned unhealthy trend. तो ये जो processes है कि amniocentesis को ban करना, MTP को सिर्फ strict conditions में लागू करना या legalize करना, this is one of the trend which can prevent the dangerous trend of the MTP, unhealthy trend of the MTP you can say, अगर उसको strictly follow किया जाए. Okay, so this is about the MTP that we have seen. Now let us talk about the very important topic, and that is considered to be as the sexually transmitted diseases. So shortly termed as STDs, which are called sexually transmitted diseases. Clear? ये होता है. Now ये जो sexually transmitted diseases होते हैं, तो word से ही आपको पता चल जा रहा है कि ये sexual contact से spread करेंगे. So this will spread actually through the process of the sexual contact actually. All right. And ये जो sexually transmitted diseases होते हैं, इनको हम RTI भी बोलते हैं. This is also considered to be as RTI, which is called as reproductive tract infections. Reproductive tract infections. or they are also known as VDs, जिसको हम बोलते हैं venereal diseases. This is the case. Clear? So you can say that infections or the diseases which are transmitted through sexual intercourse, that is collectively called as the sexually transmitted diseases, जिसको venereal diseases भी बोलेंगे या RTI भी बोलेंगे. That means reproductive tract infections. जो basic examples जो होंगे ना, STDs का जो सबसे common example होता है, वो हमारे दिमाग में जो सबसे पहले आता है वो हो जाएगा AIDS का. That means acquired immunodeficiency syndrome. Apart from this, there is syphilis, which is an example. Then there is gonorrhea. Gonorrhea hota hai. Then there is genital warts. Then genital herpes. It's genital herpes. बहुत सारे होते हैं. Trichomoniasis and all those things बहुत सारे हो जाएंगे. Your hepatitis B, ठीक है? तो includes basically gonorrhea. Then there is syphilis. Then there is genital herpes, chlamydiasis, genital warts, trichomoniasis, hepatitis B, and of course the most discussed infection in the recent years, which is HIV, that is leading to AIDS. ये सबसे common STIs में आता है. That means sexually tract infections में आएगा. Now, ये जो infections होते हैं, कुछ infections जिसमें ऐसे होते हैं basically, जो कि जिनका treatment के through they are completely curable. They can be curated. उनके साथ problem नहीं आता. लेकिन इसमें कुछ ऐसे हैं जैसे कि hepatitis B हो गया, AIDS हो गया and genital herpes हो गया. ये कुछ ऐसे आपके cases हैं, समझ लीजिए ऐसे infections हैं जिनका क्योर कर पाना बहुत मुश्किल होता है, ठीक है, या it's actually not curable. So some of these infections like hepatitis B, HIV can also be transmitted by sharing of injection needles or surgical instrument, etc., with the infected person, transfusion of blood, or from the infected mother to fetus. तो अगर main question जो हमारे दिमाग में आता है कि जो भी agent होगा, जो infections होता है, bacterial अगर agent है या प्रोटोजोन का एजेंट है या वायरल एजेंट है, तो ये ब्लड के थ्रू ट्रांसमिट होते हैं. तो अगर कंटामिनेशन होना है फ्रॉम पर्सन टू पर्सन, तो वो कंटामिनेटेड ब्लड के थ्रू होगा. So it can be through contamination of the contaminated blood transfusion. It can be through sharing of needles, sharing of any kind of hospital utensils. उन सब के थ्रू हो सकता है, ठीक है, except for hepatitis B, genital herpes and HIV infections. जो other diseases होते हैं वो completely curable होते हैं if they are detected early and treated properly. Early symptoms of most of these are minor, including itching, fluid discharge, slight pain and swellings. ठीक है, तो इनके जो symptoms होते हैं, it can be either in the form of swellings or itchings or fluid discharge or anything in the genital region. Infected females जो होते हैं, they may often be asymptomatic and hence may remain undetected for long. Infected females के केस के साथ प्रॉब्लम ये हो जाती है कि वो asymptomatic होते हैं, मतलब symptoms उतना जल्दी नजर नहीं आएगा होगा, but symptoms won't be that much visible. तो उसके वजह से क्या हो सकता है, it can remain undetected for a longer period of time. All right. Now, absence or less significant symptoms in the early stages of infection and the social stigma attached to the STIs deter the infected persons from going away for timely detection and proper treatment. क्योंकि ये topics कुछ ऐसे topics हैं ना जो बहुत taboo topics माने जाते हैं discussion के. So for that reason, it might be the possibility कि जो person होगा, it might get deterred or it might get detached from the social connections or from having any kind of social bonding, है ना? तो ये चीज हो सकती है. Now this could lead to complications later. अब सीधी सी बात है, early detection अगर नहीं होगा तो ये बाद में complications create करेगा, which includes pelvic inflammatory diseases, which is PID, then abortions, stillbirths, ectopic pregnancies, infertility, or even cancer of the reproductive tract. तो ये कैंसर भी कॉज कर सकते हैं. STIs are a major threat to a healthy society. Therefore, prevention or early detection and cure of these diseases are given prime consideration under the reproductive health care programs. Though all the persons are vulnerable to these infections, their incidences are reported to be very high among the persons in the age group of 15 to 24 years. मतलब ये जो age group होता है, इसमें जो chances होते हैं, persons of any age group can contract this disease. However, जो ये वाला age का group होता है, that means 15 to 24 years of जो age का group होता है ना, these are highly susceptible to STIs. The age group to which you also belong. There is no reason to panic because prevention is possible. One could be free of these infections by following the simple rules. That means avoiding sex with unknown partners or multiple partners. Always try to use condom during coitus. Then, in case of doubt, one should always go to a qualified doctor for early detection and to get complete treatment if diagnosed with infection. तो उसका एक पूरा complete treatment होना चाहिए if it is diagnosed with any kind of infections over there. ठीक है? So this is the case that you need to know about it, about the sexually transmitted diseases. Now, let us take a look into the next topic, and that is considered to be as infertility. Now, infertility. Now, infertility is something that means you can say which is unable to produce or conceive a baby. Okay. Simple language में अगर मैं बोलूं, so unable to conceive a baby. All right. So that is called as infertility. और ये जो baby conceive होना होगा, ये समझ लीजिए, this should be that a couple is actually unable to conceive a baby even after 2 years of having unprotected sexual intercourse. So वो condition एक उसमें लग जाती है, ठीक है? That as discussion on reproductive health is incomplete without the mention of infertility, a large number of couples all over the world, including India as well, they are infertile. That means they are unable to produce children in spite of unprotected sexual cohabitation. ठीक है? तो infertility मतलब समझ लीजिए कि एक ऐसा condition जिसमें कि that couple is not able to conceive even after unprotected sexual cohabitation. Just a second. Now, reasons जो हो सकते हैं, reasons बहुत सारे हो सकते हैं. Reasons can be many. Infertility का जब हम reasons देखने जाते हैं तो हमें बहुत reasons मिलता है, and it could be many reasons. So those reasons primarily include physical or congenital diseases or drugs or immunological or even psychological reasons as well. Now, in India, often the female is blamed for the couple being childless, but more often than not, the problem lies in the male partner. Okay? Specialized healthcare units, that means infertility clinics, would help in the diagnosis also and also in the corrective treatment. उसको वो correct भी करेगा in treating some of these genetical disorders. So in genetical disorders को treat करके, diagnose करके treat करने में भी help करता है and actually enables these couples to have a baby or a children. Now, however, such corrections are not possible. The couple could be assisted to have children through specialized techniques, which are called as ARTs. Now, we are going to talk about some of these specialized techniques, which are called ART, which is assisted reproductive technologies in simple language. So this is assisted reproductive टेक्नोलॉजीज, मतलब एक सोल्यूशन, एक रेमेडी टू इनफर्टिलिटी हम बोल सकते हैं. So there are various methods through which this ARTs can be carried out, जिसमें सबसे पहला जो important method हो जाएगा वो IVF का method आता है. That means in vitro fertilization का method आ जाएगा. So you can see कि ये method जो होता है वो lab के conditions में पहली बात तो perform किया जाता है, and it is performed outside the body in almost similar condition that is found in the body. वो सारा condition जो female के body में मिलता है ना, वो सारा conditions provide किया जाता है. Followed by ET, which is embryo transfer, is one such method in case of the ART, if you are going to consider. So, now, what is performed in this method? So, in this method, popularly known as the test tube baby program, the ova from the wife or the donor that is collected, और sperm जो होता है वो husband या donor male से collect कर लिया जाता है. मतलब ovum को collect कर लिया female से और sperm को collect कर लिया मेल से, ठीक है, और उन दोनों का फ्यूजन हम करवाएंगे लैब के कंडीशंस में, लैबोरेटरी कंडीशंस में, ठीक है. सो दे आर कलेक्टेड एंड इंड्यूस्ड टू फॉर्म zygote under simulated conditions in the lab. All right, now the zygote or the early embryos, अब zygote बन गया, तो जो zygote मतलब जो कि early embryos भी होंगे, वो zygote या early embryos जो कि up to 8 blastomeres के होंगे ना, they could be transferred into the fallopian tube. मतलब less than 8, इसके दो चीजें आएंगी, देखिए, या तो हम इसको जिफ्ट के थ्रू, दैट मींस zygote इंट्राफेलोपियन ट्रांसफर के थ्रू, ठीक है, ये एप्लीकेबल तभी होगा अगर zygote जो है इट इज अप टू 8 blastomeres होंगे, तो इसमें हम fallopian ट्यूब में ट्रांसफर कर देते हैं. तो इसमें क्या होता है, zygote अप टू 8 blastomeres. क्या ये हो जाएगा, जिफ्ट का पार्ट हो जाएगा ये. तो इसमें हम जिफ्ट के थ्रू zygote को ट्रांसफर कर देंगे fallopian ट्यूब. लेकिन अगर ये मोर देन 8 blastomeres होगा तो फिर हम एक दूसरे टेक्निक को यूज करते हैं जिसको हम कंसिडर करते हैं एज IUD. दैट मींस इंट्रा uterine transfer. So you can see over here, zygote and embryos with more than 8 blastomeres, they are transferred into the uterus. उसको डायरेक्ट हम यूट्रस में ट्रांसफर करेंगे क्योंकि उसका डेवलपमेंट ज्यादा हो चुका है. So IUD, which is intrauterine transfer, to complete its further development. Now, embryos formed in the in vivo fertilization, that means fusion of gametes within the females, they could also be used for such transfer to assist those females who cannot conceive. तो ये मेथड हो सकता है. तो IVF में दो हो गया, जिसमें आपका जिफ्ट के थ्रू भी हो सकता है या IUD के थ्रू भी हो सकता है. Apart from that, there is another method which is called as gift. That means gamete intrafallopian transfer. So as the word is suggesting, gamete को ट्रांसफर किया जाएगा. कहाँ ट्रांसफर किया जाएगा? fallopian ट्यूब में ट्रांसफर किया जाएगा. Now transfer of an ovum which is collected from the donor female into the fallopian tube of the another female who actually cannot produce the ovum. तो ऐसे फीमेल्स जिसमें कि ओवम का प्रोडक्शन नहीं हो पाएगा ना, तो उस केस में हम गिफ्ट को यूज करते हैं, गिफ्ट की टेक्निक को यूज करते हैं. बट दैट कैन प्रोवाइड द सूटेबल एनवायरनमेंट फॉर फर्टिलाइजेशन एंड इम्प्लांटेशन. तो प्रॉब्लम कहाँ आ रहा है? प्रॉब्लम आता है कि सारा कंडीशंस मिल रहा है फर्टिलाइजेशन का फीमेल के रिप्रोडक्टिव ट्रैक्ट में, बट प्रॉब्लम जो आ रही है वो यहाँ पे आ रही है कि उसमें बस फर्टिलाइजेशन की प्रॉब्लम नहीं, मतलब फर्टिलाइजेशन ओवा ही नहीं प्रोड्यूस हो रहा है. तो जब ओवा ही नहीं प्रोड्यूस होगा तो फर्टिलाइजेशन कहाँ से होगा? So this is the case. Now next is basically the intracytoplasmic sperm injection, which is also called as ICSI. That is another specialized procedure to form an embryo in the laboratory condition in which a sperm is directly injected into the ovum. तो मतलब sperm ovum के cytoplasm में sperm का direct injection कर देना, that is called ICSI. That is intracytoplasmic sperm injection. Now, infertility cases, either due to inability of the male partner to inseminate the female or due to very low sperm count in the ejaculation, could be corrected by the artificial insemination. इसके अलावा एक दूसरा टेक्निक होता है जिसमें हम आर्टिफिशियल इंसेमिनेशन की टेक्निक को यूज करते हैं इन केस अगर मेल में प्रॉब्लम आती है कि मेल का स्पर्म काउंट लो है, तो उस केस में हम क्या कर सकते हैं कि आर्टिफिशियल इंसेमिनेशन का मेथड यूज करके हम आर्टिफिशियली जो स्पर्म्स है उसको कलेक्ट करके हम फीमेल्स के रिप्रोडक्टिव ट्रैक में इंसेमिनेट करते हैं. सो दिस इज अगेन ऑल्सो अ टेक्निक. यहाँ पे आपका आ जाएगा artificial insemination, which is AI technique. And in this technique, the semen is collected from the husband or the healthy donor, and that is artificially introduced either into the vagina or into the uterus. That means IUI of the female. So AI is prominently used for in case of the males, in case of those males जो कि जिनका sperm count लो है. लेकिन IUI जो होगा intrauterine insemination जो होगा, this will be performed in case of the females. ठीक है? Now, though options are many, all these techniques requires extremely high precision handling by specialized professionals and expensive instrumentation. ये सारे जो टेक्निक्स है ना, ये बहुत ही हाईली एक्सपेंसिव होते हैं एंड स्पेशलाइज्ड डॉक्टर्स का रिक्वायरमेंट चाहते हैं. Therefore, these facilities are presently available only in very few centers in the country. Obviously, their benefits is affordable to only a limited number of people. Emotional, religious, and social factors are also deterrents in the adoption of these methods. Since the ultimate aim of all these procedures is to have children, in India, we have so many orphaned and destitute children who would have probably not survived till maturity unless taken care of. Our laws permit legal adoption, and it is yet one of the best methods for couple you looking for parenthood. So इसमें basically ये बोला है कि ये जो मेथड जितने मैंने आपको ART के बताए, these are only applicable for those people who are financially very very stable and financially economically जो कि बहुत stable है, उनके लिए सिर्फ ये है, क्योंकि इसमें हाई एक्सपेंसिव प्रोसेस होता है. ठीक है, लेकिन अभी भी हमारे कंट्री में अडॉप्शन को या ऑर्फन चिल्ड्रंस को अडॉप्ट करना इज स्टिल अ काइंड ऑफ अ लिटिल टैबू सब्जेक्ट जिसको कंसिडर किया जाता है और जो भी एनकरेज नहीं किया जाता. ऑलराइट, बट हमारे लॉज के थ्रू इसको भी लीगलाइज कर दिया है, इसको भी परमिशन प्रोवाइड कर दिया है दैट अ पर्सन कैन गो फॉर द पेरेंटहुड एज वेल. ऑलराइट, सो दिस इज ऑल अबाउट the reproductive health chapter that we have dealt today. All right, तो ये इससे हमारा पूरा खत्म हुआ. यहाँ पे कुछ questions दिए हुए हैं which you can see over here. Like, what do you think is the significance of reproductive health in a society? तो मैंने आपको बताया था reproductive healthy society जो है वो एक ऐसा society होगा जिसमें कि a person is not only physically or mentally or socially or emotionally fit, वो उसमें overall well-being लिया जाता है. तो reproductive healthy society का significance ये है that the total well-being is taken into account. That's why the study of reproductive health is very very important. Now suggest the aspects of reproductive health which needs to be given special attention in the present scenario. Now इसमें जो सबसे important चीज है वो है कि introduction of sex education in the schools. जो मैंने आपको सारे जो की पॉइंट्स बताए थे ना, वही आप यहाँ पे मेंशन कर सकते हैं कि जो सेक्स एजुकेशन, ओपन डायलॉग्स होना चाहिए, सेक्स एजुकेशन होना चाहिए. देयर शुड बी अ क्लियर व्यू रिगार्डिंग adolescence or pubertal related changes in the body, or you can say STDs or sexually transmitted diseases. इन सब के बारे में पूरा एक क्लियर व्यू एंड ओपिनियन होना चाहिए. So is sex education necessary in schools? Yes. Why? Definitely. क्योंकि ये कहीं ना कहीं हमारे reproductive health को क्या करेगा? Promote करेगा. So definitely yes. Do you think that reproductive health in our country has improved in the past 50 years? If yes, mention one such areas of improvement. Definitely improvement हुआ है. So you can say yes, there is an improvement. And वो improvement हुआ है. दो समझ लीजिए दो process के through. One is considered to be as the RCH program, which is reproductive and child health care program, and family planning programs के through. तो ये दो examples आप इसमें दे सकते हैं. Now, what are the suggested reasons for population explosion? मैंने आपको already बताया हुआ था that better health infrastructure हो गया है, देन इकोनॉमिक स्टेटस बहुत अच्छा खासा इम्प्रूव हो चुका है. तो ये कुछ रीजंस हैं जिसके वजह से पॉपुलेशन एक्सप्लोजन हुआ है. Now, is the use of contraceptives justified? Give reasons. So yes, you can say कि contraceptives को use किया जा सकता है, but only up to a limited extent and under the prescription of doctors. Cannot be used regularly. इसमें आप बता सकते हो क्योंकि contraceptives ऐसे methods होते हैं जो कि severe cases को avoid करेंगे. Like if there is a case of rape, या unwanted pregnancy आ गया, या कोई ऐसा baby है which is ultimately genetically suffering और disorders है उसको, तो उसको हटाने के लिए contraceptives are justified. ठीक है. Removal of gonads cannot be considered as a contraceptive option. Why? See, removal of gonads will ultimately result into a kind of a sterile condition. वो पूरी तरीके से sterile कर देगा, sterility को पूरी तरीके से cause कर देगा. So that's why हम sperm के formation and ovum के formation को prevent नहीं करते, हम सिर्फ उनके transfer के method को block करते हैं. तो ऐसी चीजें होती हैं. So that's why this cannot be considered as a corrective option, contraceptive option. Now, amniocentesis of sex determination is banned in our country. Is this ban necessary? Yes, definitely. Female feticide के number को अगर decrease करना है, so that's why it's very, very necessary. Suggest some methods to assist infertile couples to have children. अभी जितना मैंने आपको techniques बताया ART का, वो सारे techniques हो जाएंगे. ठीक है, वो आप mention कर सकते हैं यहाँ पे. Now, what are the measures that one has to take to prevent contracting STDs? Avoiding, sexual contact with multiple or unknown partners. Always wear condom during coitus. And इसके अलावा आपका जो मैंने बताया था कि जो STDs होते हैं उनके बारे में awareness and regular. अगर severity बहुत ज़्यादा बढ़ गई है, then go to a very prescribed doctor, or you can say a very medical practitioner के पास जाएं और उनका फिर suggestions and सलाह ले सकते हैं. So that is again also a method. Now you have to state the true and false. So abortions could happen spontaneously too. हाँ, हो सकता है abortion spontaneously भी हो सकता है, मतलब अचानक भी हो सकता है, in case अगर proper embryonic care and protection नहीं किया गया तो. Infertility is defined as the ability to produce a viable offspring and is always due to abnormalities or defect in the female partner. False. ये false है. Male partner में भी defects हो सकते हैं. Complete lactation could help as a natural method of contraception. True. बिल्कुल. जिसमें lactational amenorrhea का मैंने आपको बताया हुआ था वो हो जाएगा. Then creating awareness about sex-related aspect is an effective method to improve reproductive health of the people. True. ये भी हो जाएगा. ठीक है. Now correct the following statement. Surgical methods of contraception prevents gamete formation. Surgical methods of contraception they not prevent gamete, they gamete के transfer को prevent करते हैं. तो यहाँ पे formation नहीं होगा, यहाँ पे हो जाएगा transfer. ठीक है, ये हो जाएगा. Now all sexually transmitted diseases are completely curable? No. कुछ ही curable होते हैं, कुछ uncurable होते हैं. Most of them are uncurable. Oral pills are very popular contraceptives except among the rural women. Oral contraceptives are, they are very popular. Rural may be popular है, but this is also popular in case of the urban people as well. Urban women में भी ये popular है, तो दोनों हो जाएंगे इसमें. And in embryo transfer techniques, embryos are always transferred into the uterus. बिल्कुल भी नहीं. Embryos जो होते हैं वो MET के transfer में के technique में वो fallopian tube में भी उसको transfer किया जा सकता है. तो इसका ये reason हो जाएगा. ठीक है. So this is all about the exercises that we have done. PYQs, that means MCQs might have been provided to you, या आपको provide कर दिया जाएगा regarding the reproductive health. So till then, keep practicing, keep learning, and do keep joining. Thank you very much.